Terrific. Well, the show is yours, my friend. Take it away.
Great. Great. All right. Well, thanks everybody for joining today. We have a very interesting show lined up, and welcoming here Peter Barsoom, CEO of 1906. Peter, how are you doing today? Thanks for coming on.
I am doing great. Thank you, Eric. It's a pleasure to be here.
Excellent. So, Peter, I think you've been around for quite some time. A lot of people know about the brand 1906, but there's always a few people that haven't really heard much about you. So if you would just start giving us a little bit of a background on your company, how you got into this, and kind of where you are right now in terms of how many states you're operating in, that'd be fantastic.
Yeah, absolutely. So Eric, to give you a little background, 1906, we started in Colorado, launched the brand in 2017. And our mission was to bring cannabis as an alternative to alcohol and pharmaceuticals to adults across the country. Cannabis is one of the most amazing plant medicines known to man. And we started the company because we believe people should have access to the best possible cannabis experience and to other plant medicines in order to address the complexity of the human condition, whether it be pain, sleep, anxiety. Cannabis could potentially have a role to play. And if it's going to do that, it needs to work like alcohol and pharmaceuticals in people's expectations and consistencies. So that's a little bit about how we, why we started. And today, proud to say that we're currently available in 9 dispensary markets, and then across the country through our 1906.shop, where you can get microdose 1906 cannabis products delivered directly to your door.
Nice. 9 markets. Fantastic. So when you started this, from day one, you had this kind of concept of functional cannabis. Okay, what does that mean to you? What does functional cannabis mean?
For me, functional cannabis means that it works. It's not just about getting high and checking out. It's about using it for a particular desired effect, whether it be to help with sleep or energy or focus or anxiety. And frankly, most people who use cannabis are looking to use it for a particular reason. My kind of high is different than your kind of high. And so we think that we're meeting the needs of the broad swath of adults who are looking to use cannabis.
So let me show the users here some of your products that haven't seen them. We have one called Love, we got Go, we got Genius, we've got Bliss. Very cool product format, which is a pill or a tablet. You refer to them either way, pills and tablets. And I'm curious, kind of, when you came into this, like some of the products that this format, right? Who have you found it appeals to, and maybe who does it not appeal to? I mean, it's not flower. We're not smoking it. It's a pill. What has been your experience, and kind of, what have been the learnings around this format of tablet/pill?
Yeah. So to share with you kind of how we got here, the premise behind 1906 was always about, it starts with how is it you want to feel first, and then how is it you want to consume. So when we started in 2017, first we started with chocolates, and then we introduced our pills in 2020, and we're going to be introducing new product formats, including gummies, later this year. The pill emerged because we heard from a lot of consumers that they don't want to smoke, and they don't necessarily want to be consuming sugary chocolates or sugary gummies. We talk about cannabis as medicine, but it wasn't really available in a truly medicinal format. And so the pill is a wonderful format in terms of it's vegan, it's gluten-free, it's sugar-free, it's fast-acting, it doesn't melt. It has shelf life, and for a lot of people that are replacing opioids, or they're replacing SSRIs, or replacing antidepressants or ADHD medication, they're typically taking that as a pill. And we see it is as one of many product format options that consumers should have. We frankly, we didn't expect it to be as successful as it was, but the pill became, our drops became an overnight success, and now we are the #1 pill in the country, and realize that there's quite a lot of people out there who don't necessarily want to consume either by smoking or consume either through sugary gummies.
I want to get to kind of the go-to-market strategy and talk about your hemp product, but I'm curious if what have you learned in terms of like the consumption? Like, who is your demographic? Did you start with a very specific demographic of wellness, maybe an older, I don't want to say boomer, but like, what is your demographic in terms of who has adopted this, and how does the heavy user, relate to your format?
Yeah. What I would say is, look, we have a very strong following in particular around adults. I would put it in the 25 and older category, and then who are looking for cannabis kind of as part of their wellness routine. We don't think in terms of specific demographics, Eric, because if we take something like sleep or pain, those affect people whether rich or poor, black or white, LGBTQ or cis. Those don't have demographic filters by who they impact. And so we tend to think of this not in terms of a demographic segment, but in terms of a segment of people who are looking to use cannabis for a specific need, that they care about the quality of what they put into their body, and they want to tune in more than tune out. And so those are the parameters of the people we tend to attract. I would say we index probably more female than male, unlike the rest of the cannabis marketplace. And we've got a particularly strong following, for people who are looking, who are coming new to cannabis, or it's been a while before they've taken cannabis. We've had people call 1906 cannabis for control freaks.
Yeah,
for people for people who want to be sure that they're getting a dialed-in experience that's fast acting. They know exactly how it's going to make them feel. They know the dosage is right, and they're not willing to play Russian roulette with a psychoactive substance.
Nice. So one more question on the format, and then we'll dive in. People are very used to taking the pill. I took a couple Advil this morning for my shoulder, so on the one hand, very common use case, take Advil, take whatever you want, Tylenol. On the other hand, like the opiate endemic, right? So we have like there's these two things. And some people are like, no, I don't want to take any pills. Maybe that's why I go to cannabis, because I want to smoke it. I don't want, to take more pills. I've got this kind of fear factor. Where do you like, those are kind of pros and cons, where like on the one hand, it's common use of most people almost all the time. On the other hand, it has certain kind of connotation. How do you straddle that?
Yep. Yeah, great question. And that's one of the things that we've had to work hard around, which is pills have a bad rap. And often because in many communities, they've caused harm. Now, the pill itself as a format, there's nothing bad or negative about the pill as a format. It's often been the intentions and how it's been used. So one of the things that we had to spend a lot of time doing is destigmatizing pill. And what did we do? So first, we changed the name. We called them drops, not pills. Second, we made it into an attractive shape so that it looks more visually appealing and easier to swallow. In fact, we have a patent on our shape as well. And that was designed scientifically to make it easier to swallow. So that was the second thing. Third is, don't put it in a typical pharmaceutical plastic packaging. but put it in a more attractive tin that's more sustainable, environmentally friendly, and makes it more appealing. And then educate people around it. So it's been a journey of breaking down the stigmas that people have behind pills or pharmaceuticals, and educating consumers and the rest of the industry that, hey, as a product format, this is right for many people. Like I said, because it's discreet, it's easily dosed, it's precisely dosed, it's sugar-free, it's vegan, it's gluten-free. Frankly, it's the healthiest way to consume cannabis. But we also recognize that it's not for everybody, and so that that's why we have a line of chocolates in some markets, like New York, and then we're excited to be launching our line of gummies soon as well. So that way, consumers will have alternatives. If you want to have the great pleasure of a vegan, a great tasting gummy, then you'll have that. If you want to have the discreetness and the that a pill offers, you can have that as well.
Awesome. Very, very interesting. So kudos to all that you've achieved there. So let's talk about your go-to-market strategy, because when you and I talked a week or so ago, my thought was, okay, you need to find a partner in every market you go to that knows how to do this. I've seen those tablet machines, those pill presses. Not only they're expensive, but they're complicated. They're not, if you're a large pharma company, that's one thing, but you've got lots of different ingredients. So it's not as straightforward as one might think. So, but that's not actually, you don't rely on anybody to do that. So take us through kind of how you go to market and your unique model.
Yeah, and that's one of the things that really makes us different, is the focus on science, the focus on precision. So we've got a whole team of folks who work decades in the pharmaceuticals and the nutraceuticals industry, and making a pill takes special skills and special equipment, which is why people don't make them at home. For instance, like you can make brownies. So given that and our relentless focus on quality and execution, what we developed is a model whereby it's always 1906 employees and 1906 equipment that is producing the 1906 drops. Now, as everybody here knows, cannabis can't cross state lines in the regulated market, so you have to produce and sell in every single market. Now, if we were in 9 markets and we had to put a pharmaceutical operation up and running in 9 markets, that would cost $10 to $20 million easily to support that, just the capital expenditure, let alone all the staff that's there. We didn't have that kind of capital when we launched back in 2020, so we had to improvise. And how did we improvise? Well, because you can make our drops in high volume and they're shelf stable, what we developed is a business model where we bring our people, our equipment, and everything but the cannabis to each market. We set up shop, and then we produce over the course of about 6 to 8 weeks. We produce enough supply for the next 3 to 4 months, and then we pack up and leave and move to the next market. So what does that do for us? That allows us to ensure, number one, that it's always 1906 people and equipment. So every product, whether you buy it in Colorado or you buy it in Massachusetts or Pennsylvania, is the same quality and consistency. Number two, it's much more capital efficient because we can use equipment across multiple markets as opposed to fixed equipment. Number three, it's a much better carbon footprint as well. We're maximizing the use of our resources across markets, and it allows us to enter and exit markets quickly and smartly because we've lowered the investment of what it takes to open up a new market. That also means that we can test and learn, see which markets work, and markets that don't work, we can easily exit.
So, not knowing a ton about the options of the machinery that you purchase, has there, I mean, do you just have, first of all, let's start with the basic question of like, do you have just you load up a truck and you drive it to a market? I mean, you got markets on the West Coast, East Coast. Like, how do you manage this? Let's start there. How do you manage all these markets? Do you have one rig, or what's the setup?
Yeah, so currently, given the markets, we have 4 rigs right now. So we can be in simultaneous production in 4 markets. And, you know, we've added more rigs as we've needed to. Our geographic focus now is on the Midwest and the East Coast. So we're actively producing Oklahoma, Missouri, Illinois, New York, New Jersey, Pennsylvania, Massachusetts, and we're currently in market in Michigan as well. So we've got 4 of these rigs, and it's about $1 million worth of equipment, give or take, for each of these rigs: tablet press, coaters, dehydrators, scales, and other specialized equipment for nutraceutical manufacturing.
My guess is that your first rig and your 4th rig look pretty different, right? With all the experience you have.
Yeah, we add new features. It's like, imagine kind of your first car when you're 16, and then your car when you're, you know, in your mid-30s.
Yeah. I mean, is there bespoke design that you've added to the rigs that is, I mean, I'm not getting into the proprietary nature, but I mean, you've obviously had to custom these things for a very unique form factor. I noticed like there's scoring, there's all sorts of stuff on there that might be interesting in terms of IP.
Yeah, the great thing about this industry is that it's, you know, well tested. It's a big industry, and so, you know, the equipment and everything there actually is, we don't need to customize any of the equipment, thankfully. The molds and the dyes, you know, those are custom to our shapes. But other than that, we get to use, you know, high quality pharma grade equipment across the board, and that's what also gives it the ability to produce consistency, is the fact that, okay, you know, there's a whole industry that is focused on the consistency of tablet manufacturing, and that's what we're plugging into.
Yeah. So that's got to provide, you mentioned it, but it's got to be pretty, I mean, okay, you got about $1 million per rig. That's a CapEx, and that can be, you know, that's not, you know, not peanuts, but it's manageable. But the OpEx savings have got to be pretty significant in this model. I mean, you've got no overhead. You kind of roll in, and we're going to get to the partner in a second, but just to find, you know, to sign off here on OpEx versus CapEx. I mean, what are your challenges? I mean, inventory, or where does the money go on an OpEx basis? It's not a lot.
Yeah, you know, it creates more, so it does a couple of things. One, it does create, put more demands on kind of working capital and cash flow, because we're building up, you know, 4 months worth of inventory and then selling it down, unlike, you know, if you're in continuous production. So from that perspective, there is an increase in cash flow needed. And then there's also, you know, just greater logistics in terms of, you know, managing the movement of people, and we do have some additional, I would say, OpEx in terms of travel and Airbnbs for our technicians who are going out to different sites. But that is definitely more than offset by the greater efficiency that we have from having a first-class SWAT team of folks who are just making 1906 products.
So let's jump in. There's a fascinating discussion to have next alongside of this, and that is your entrance into the hemp market. So all of those, I mean, in a perfect world, all of those constraints in the regulated market go away with hemp, because you can ship. Can you ship to every state, or where are you boxed out?
There are about 10 states that we currently can't ship to because of state laws, you know, including Colorado, for instance, Massachusetts. We don't ship to New York right now. So there are a handful of states that have enacted prohibitionist measures to restrict consumers' ability to get 1906 products shipped to them, unfortunately.
Yeah, so you're able to ship to the majority of the states now. So obviously it's a contentious issue. Obviously politically it's contentious in Washington, but it's even contentious in our own industry, right? With the regulated folks saying, hey, this isn't a fair playing field, and the hemp folks saying, you know what, it's what people want. The consumer speaks, you know, come on over to our side. It's what we've been dreaming about forever. When you were deciding to make a move into hemp, which I guess what is that, about a year ago? What were the influential factors? What were the, you know, things that you were actually thinking about relative to those, you know, how much to invest? Are we, you know, just are dispensaries going to be angry? You know, what are those? What was the concept into you going into this market, into the hemp derived market, and you know, learnings there?
Yeah, great. We looked at it in terms of kind of a number of criteria. So first is the consumer. We started in 1906, and our name is the year that started the prohibition of cannabis. So ending prohibition on and ending the racist war on drugs and giving adults access to safe, legal cannabis, as well as other dietary, as well as other supplements and medicines. That's been kind of our North Star. So we started in 1906 because we believe people should have access to cannabis like they used to back in the day of 1906 before it was prohibited. So whether it be, you know, hemp derived or not, these are just sort of details about how people access cannabis. The key thing was, hey, is this the way in which consumers want to access this, and can we do this kind of safe, legally, you know, so on and so forth. So the first element was, is this good for the consumer? And the answer to that was a resounding yes, in terms of there's a lot of the country that lives too far away from a dispensary, and they could use the benefits of cannabis. So that was number one. Number two criteria was, you know, legal and regulatory. And last year, when the FDA basically said that, hey, we're not going to pass or promulgate any rules as it relates to THC and CBD in food or dietary supplements, that's what opened up the pathway to know, okay, so there's no going to be FDA action, so we can rely upon federal law now, and so we can do this fully legally as well. You know, people were doing Delta 8 and some other products that, frankly, you know, introduced either too much consumer safety risk or too much regulatory risk. So we needed the second part to be satisfied, which, yes, we can do this from a legal and regulatory perspective. And then the third was, we actually saw the success of companies like Can and other beverage companies, that consumers were willing to buy a 4-pack or a 6-pack of beverages and have it shipped directly to their home. So and that's not even typical consumer behavior. Most people, you know, when they buy a drink or cans of beverages, they walk to their local liquor store or the convenience store or supermarket. So consumers are seeking out cannabis online in order to have it shipped directly to their home. And that basically, once we satisfied those three things, that yes, this is, you know, what consumers want, yes, we can do this legally, and third, there's actually market traction here, that's when we decided last April, let's get into this. Then the next thing we needed to look at is, you know, what's the right product format, and how do we have a successful omnichannel strategy? Because the idea isn't to just move people who are buying online, move people who are buying in the dispensary to the online channel. The idea is to broaden the market. And we did that in a very thoughtful way. Our products online are more expensive than what's in the dispensary. They're lower dose. So similar to beer and liquor, where you can buy beer in a gas station or a convenience store, but you have to buy liquor in a liquor store. That was the same approach that we followed. High dose, go into the dispensary. Low dose, 2 milligrams, buy it online.
Gotcha.
And it's worked. it's worked. So we launched at the end of last year, beginning of November, and since launch, we've done $3.5 million of online sales in just the last few months, which is amazing.
I mean, it's on the one hand, it's what everybody wants to hear in this industry. It's what everybody wants to do, and obviously, having one centralized production facility and being able to ship across the country, that $3.5 million you're talking about has got to be far more profitable than the regulated market and the rigs and the manufacturing and the logistics and all marketing and all that.
Oh, yeah, absolutely. We get to run a normal business, like where we can produce in one place, we can ship across the country. People come to our website, they give us their credit card, and we get to charge their credit card. It ships via UPS or FedEx or US Postal Service. Like this is what we as an industry should all be wanting.
Peter, I don't want to turn it into a regulatory discussion, but again, I mean, we're all following this, and no one knows where it's going, but there's still a decent chance that this is regulated out, right? And the Farm Bill is updated, and where are you on that continuum? I've heard plenty of people say the horse has left the barn, that ain't happening, and plenty others that say, oh, you just wait and see. So again, where are you, philosophically first, but then practically from the business perspective, seeing $3.5 million go out the door that's that profitable would be a bit of a blow, on an unfortunate blow. But nonetheless, where are you on the continuum of Farm Bill regulation and where you think this is going?
Yeah, look, we think there should be regulation of the cannabis market, in whatever format it's sold and in whatever way people access it. And I think you can achieve the desire of accessibility, the end of prohibition, and safe, regulated products here. So as an example, we've been very active in saying, hey, a really good regulatory structure would eliminate the synthetic cannabinoids like Delta 8, HHC, THCO. Like we don't need them. There's not enough information and history about those, and there's no reason that consumers should have that. So for us, those synthetic cannabinoids are too much risk and unnecessary for a well-functioning market. Second is, we'd love to see a market where, let's say, products that are below 5 milligrams can be sold, widely and be widely distributed, just like beer. And anything above 5 milligrams would be in a more of a regulated dispensary. Okay. That's how liquor works, and then all products should be tested, third-party tested. And by the way, we're following all these things. Our products are 2 milligrams. Our products are tested, third-party tested. We only procure hemp from licensed organic farmers, for instance. So we can achieve all of the public policy benefits of a safe, regulated market. And we think there's an opportunity for the industry to come together to promote such a platform. As it relates to the Farm Bill, I recently got an insider's briefing, and the expert word is the Farm Bill is going to pass like it did last year, which is no changes, as is for a 1-year extension. There's not enough days in the Senate and the House calendar to actually really do a markup. And even though we've seen kind of markup of some of the Farm Bill, it's highly, highly contentious. By the way, it has nothing to do with hemp. SNAP and the other elements are the parts that are contentious. And given that it's Congress, and Congress is unable to really move forward on something new, the expert word is that the Farm Bill is going to get renewed for a year. So we'll have the opportunity to revisit this a year from now. But frankly, that's a big victory, because a year from now, the market is going to be multiples, much larger than where it is right now. And that existential risk is going to be diminished. You're going to have liquor and other players who are interested in participating. And so we think we're in a really good regulatory shape.
I have a quick question that like, so, here's Bliss, right? And what showed the Genius and some of the other ones. Is it obviously functional cannabis? Do you make a distinction with your products names when you go regulated versus hemp derived? Is there different names for the products? Is that part of the channel conflict fix?
No, because I think of it more like it's really the differences in dosage, right? If you want the low dose, 2 milligrams, so you can get Bliss in a dispensary or you can get Bliss online. The difference is the dispensary version is 5 milligrams, the online version is 2 milligrams. So if you want, if you need, typically somebody who needs 6 milligrams, you'll take 3 Bliss drops, for instance.
Gotcha. Okay. All right. So let's, DeepRoots is about the kind of best practices for brand expansion. We haven't talked a lot about that. So let's spend the next half hour here talking a little bit about that. So regulated market, you want to move into a new state, you dial up some potential prospect partners. What are you looking for in a partner? What do those initial conversations look like in terms of fulfilling your needs?
Yeah, selection of partners is very, very important. It's like getting married because it's not easy to switch partners. We have done it in a couple of markets, but it is highly disruptive. So it's important to get your partner selection right from the get-go. The important criteria to look for is, one, financial stability, because they are collecting the revenue, and so they need to be able to have good collections and good remittances back. Two is that they have the logistics infrastructure, to distribute the products. Because what we do is we always handle the two most important elements of the product, which is the production and the sales and marketing. And then we leave the back office work, the invoicing, the distribution of it, to our partners. So we need to make sure that our partners have the vehicles and the people and the wherewithal to quickly distribute products to dispensaries. Third is that they have the requisite space and infrastructure. And when I say infrastructure, it's the compliance infrastructure, the regulatory infrastructure, as well as the physical infrastructure. So those are the criteria, and we try and do everything possible to insulate ourselves against, things that could happen at the partner, but you can't fully insulate yourself from your partner. That's why they're called partners. And when we stick to those three criteria, that works for us.
And so is that, I gotta believe, because it's critical, like that's about, hey, if we want to do some business together, show me your balance sheet, show me your P&L, I'll show you mine. Like we're serious, but you got to be serious too. So the financial due diligence on your partner has to be front and center as a gating point, right?
Yeah, absolutely.
Yeah,
absolutely, especially the state of the industry today.
So what you're doing is the structure of the deal, you're basically like renting space, or how do you, it's not a reverse, it's a reverse license from what most people do, but so what are the structural dynamics of the model?
It's structured as a licensing agreement because we are technically licensing our IP and everything else to the partner. They are the manufacturer of record. Our employees are badged and they have to go through all of their compliance training, and so they're treated like employees at the site. Yeah. And like I said, we've been doing this now for years, so we got this really dialed in. Personally, I think that the days of us opening up many new markets are gone, given the growth of the direct-to-consumer and the hemp market. We love the markets that we're in right now: Illinois, Missouri, Oklahoma, New York, New Jersey, Pennsylvania, and Massachusetts. But We can access, the Florida market, much easier to access through hemp derived. The Texas market, the California market, Maryland, you name it. The rest of the markets, it's much better for us and for the consumers, when they can just shop online. So I don't see us opening up many more dispensary markets. I want to reiterate how important the dispensary market is, because that's where people discover and that's where people get educated. And we believe that as we're investing in advertising and marketing around the brand and that halo effect, that's going to drive people in, just like any traditional brand, that's going to drive them into local stores where they can purchase the product, as well as to go online.
So in the regulated market, your partner in a market is effectively selling you distillate, right? They badge your employees, but you're doing all the heavy lifting. They're dealing with logistics, right? Delivery, collections, and a few other, other things. But in terms of like what the economics of that relationship with, is it structured as like, okay, we're going to it's 100% of revenues and we're going to split that up 50-50, 60-40, whatever that is? It's that still on the wholesale cost? Is that still how you structure it, rather than just paying an enhanced rent check or what have you?
Yeah, we think that works best because we want our partners to be incentivized as well. So we think a wholesale revenue split is what works best. They deserve to earn a good profit. They've invested in the infrastructure and getting the license and operating it in their maybe at some point in time there'll be like traditional contract manufacturers in this industry, like there is if you were launching a beverage, for instance, right? Mm-hmm. If you're launching a beverage, you would go to a co-packer and they wouldn't charge you on a percentage of sales. They would charge you, okay, you want to make 10 units, it's going to cost you this much. You want to make 1 million units, it's going to cost you this much. And but the industry isn't there yet.
Yeah, what's kind of fascinating, I mean, you're one of the more mature hemp-derived companies. I mean, you're still small, it's growing nicely, but you're over a year into hemp. How does the marketing, I mean, in theory, the marketing supports the brand, and the brand is in sales and rec markets across the country, nine rec markets, and then, but you're even selling direct to consumer in some of those markets. People in Illinois are finding you online. But do you think about the marketing as two separate strategies, or is it just brand building with the same message and then the nuance of, well, if you want low dose, you go to our website. If you want high dose, go to the dispensary. Like it's a bit of a conundrum. How do you think about the marketing of those two initiatives?
Yeah, we think about it. I think it's simpler, and we in the sense that if you have a shoe and you're Nike, right, you're going to be promoting your shoes, and there are multiple ways in which somebody could buy those Air Jordans, right? And they come in different sizes, and they come for children, they come for men and women's, but it's coming from Nike, it's an Air Jordan, and you can buy it in multiple ways. Well, that's similarly here. This is bliss. Bliss makes you feel happier. Chill makes you, relieves your anxiety. Whether you need it in a 2 milligram version or a 5 milligram version, whether you live in Illinois and can walk into a dispensary, or you live in Texas where there aren't legal dispensaries, you can get chill, and that will help with your anxiety. So I'll give you an example. This weekend, we had a mention in the New York Times for our Genius product. So we're using that mention, and we've created ads with that mention New York Times. Partying, was all around how to party smarter, not harder. And we're now created that as an ad that we're running. So that's a way in which we're bringing it all full circle, that it was mentioned in the New York Times because it was purchased in a New York dispensary, not because it was purchased online. We take that mention, create an online ad for it, promote it across the country, And guess what? If you're in Illinois and you see that ad, or if you're in Massachusetts and you see that ad, you'll walk to your dispensary. If you're in California or you're Texas or Florida, you're going to go and buy it online. But it's all around genius.
Yeah. Genius. I think what's genius is party smarter, not harder. I love that. So you clearly have, like, I think what you're saying, what strikes me is like your marketing strategy is consumer centric. It's all about the consumer. It's not about trying to explain to the industry on a B2B basis why the products are different. Of course, they are different, and you'll have that discussion. We're having that discussion. But in terms of what are you trying to drive, you are trying to drive, a message to the consumer that it's available everywhere, but more importantly, it's functional.
Exactly. And I think that's, that's the work that we need to do as an industry, because we've had 100+ years of prohibition, and that has had, all kinds of negative impacts, clearly, particularly on marginalized communities that have suffered. And it's also had impact on consumers not being able to get good information, education, so on and so forth. So part of the beauty of what the hemp-derived space opens up is the ability to engage customers in ways that we couldn't before. Like, we couldn't do Facebook ads before that. We couldn't do in-person activation events. So there are influencers and others who didn't want to participate or make it public, because it was federally illegal. Now that we've lowered all those bars, we get to do the work of educating customers and meeting them where they want to be met.
Yeah, that's it, right? Meet them where they want to be met.
Yeah.
By the way, we have some questions coming in, folks. We'll get to those questions. There's some good ones, so we'll get to those in a second. A couple more questions then, just in terms of back to regulated and your state expansion strategy. People talk about it all the time, and you've done it 9 times. What would you say, just at a high level, like what's the hardest part about it? And answer the question both from the hardest part of it for 1906, as I think this is the hardest part, as well as the hardest part of the relationship and the challenges that you have in partnering, and how you might alleviate some of those problems, or fix, or unfortunately divorce if a case has happened in that case. So what's the hardest part, both from 1906 perspective as well as from those partnerships, and what can people learn from your experience?
I think one of the hardest parts is that for a lot of customers, the dispensary experience can be very challenging. And let's take a case. Somebody walking into a dispensary, and if it's a busy dispensary, what's the first thing that happens? So they're being asked for their ID, and so already that's like before you can even walk in the door, you're being asked for your ID, and in some cases maybe even frisked. So that alone doesn't make for like a warm, comforting experience, because if you're asked for an ID, what does that mean? There's a chance that they may say no to you, and you may not be let in, right? That's a moment of no, as opposed to walking into a department store, walking into even a liquor store. The door is open and you're welcome right away. Then you walk in, and there are sometimes 400, 500, 600 SKUs in a dispensary. 600 SKUs in a dispensary. That's a confusing mess. So the pressure on you as a consumer to know what you want, let alone even a staff member. How can a staff member know 600 SKUs across concentrates and vapes and edibles and topicals and beverages and so on and so forth? So then the final part is, if it's a busy dispensary, you have a minute to make some decisions and talk to a bud tender. And this is for something that's going into your body as a psychoactive substance, right? When you're walking into a dispensary, for a lot of people, it's like the last stop on their journey. If you're in pain, you've already gone to your pain doctor, you've already gone to the GNC, you've already gone to other things. And for a lot of people, like cannabis is like the final step. It's not the first part of their journey in dealing with pain or sleep or these other issues. So you've created this whole experience, which is can be anxiety inducing. And I think therein is one of the biggest challenges about operating in the state regulated market. Is the high regulatory challenges that make for a not so great customer experience. Now, a lot of times you meet a bud tender and you can have the best possible experience because they take the time to educate you, and now you've become a consumer for life. And so those are the great parts of why we love the dispensaries. But it's important to recognize that it's a challenge.
Yeah,
it's a challenge there.
It's got to be, because I mean, really, the form factor. I mean, you're not alone, but I mean, at least someone's coming in saying, "I want an edible," and then the bud tender is naturally going to launch into an explanation of why this gummy is different from this gummy is different from this gummy, and your job is to say, "Oh, and there's also a pill that's available for you, different, and that for these reasons." So it's like you've got this educational challenge. In fact, there's a question here that it says, how are you integrating the online marketing efforts with your field marketing strategy? That's, I guess, probably a better way to ask the question that I asked before about the higher level branding, 1906. But this is kind of an integration of, it is different. It is a different marketing strategy. How do you integrate the online with the field marketing, and how does that differ?
Yeah, I'll tell you, so we're still figuring that out, is the honest answer. How to make that work. Now, in some markets where we can't sell online, like Massachusetts, it's pretty simple because it really is just to focus on then our traditional field marketing strategy. But then we have other markets like New Jersey and Illinois where we can sell online and we can activate. So maybe there the opportunity is to do activations not just at the dispensary but in other places, and use a playbook from Red Bull, for instance, in terms of how they're doing field marketing. So this summer will be and fall will be an opportunity for us to test and learn how we can integrate our online with our field marketing efforts there. So if I come back on your show in 6 months, I'll be in a better position to answer that.
No problem. So another question that we got some good questions. So I'm going to let the viewers chime in. If Schedule 3 is the federal medical MJ channel, do you see hemp as the future of federal adult use market?
Yeah, I do. I really do. I think that's where the market is going. That's where we're going to see, and that's where we're seeing innovation. Part of the challenge of the state regulated markets is the barriers to entry are so high. And it's dominated in many markets by large publicly traded multi-state operators that are well capitalized relative to entrepreneurs. If you're an entrepreneur, right, and you're like, okay, I want to get into cannabis and I want to start something, how am I going to do it? Well, it's nearly impossible for you to get a license in New Jersey or Illinois or Massachusetts to start. So what are you going to do? Okay, how is it I can set up business? And the answer is you can get into the hemp space and do it. So we're going to see entrepreneurial activity, which is also going to drive the market. And look, this is no different than in tech or in beverages or in anything else like that. The more we can create opportunities for entrepreneurs to create businesses and business models and products that meet the consumer, that's where consumers will meet the market as well. And that's why I think hemp is the future. The ability to distribute hemp-derived products outside of the retail dispensary channel in like liquor stores, for instance, are really, are very exciting. And so this is, at least for edibles, flower, I think will still be in the dispensary for sure. But when we start looking at infused products, beverages, and edibles, hemp all the way, I think is the future of how most people will be accessing. Again, high dose should remain in the dispensary channel, but for everything else, like beer, should be more widely accessible.
Gotcha. Yeah. Yeah. A couple questions that people are asking around some of the logistics of your partner model. There's probably a few co-manufacturers here that would love to bring you in to a state you're not in. But in terms of, how you actually do this, do you just park the rig and do everything in the rig on the facility, or do you have to set up in each partner's market in facility?
So while we were inspired by Breaking Bad, we didn't duplicate Breaking Bad. Nope, we do everything inside a licensed facility. Everything is on cameras. There's a lot of power requirements and health and safety requirements. So this isn't the kit mobile if you grew up in the 70s, or or Breaking Bad in a van.
Yeah. Okay. So you bring everything, but you set up and you bring the packaging too, right? I mean, you do everything.
Yeah.
Yeah. Okay.
Yep.
Nice. And a question around natural ingredients, or additives, and how do you think about that?
Our goal is, and we're moving to clean label this summer, thankfully. It's been a long journey. The pharmaceutical industry, which dominates the suppliers, getting natural colors and natural ingredients to replace some things that are in our pills has taken years. And I'm finally proud to say that, this year, later this summer, we're eliminating the FD&C and other colors. We're eliminating a number of things in our product and moving to clean, natural ingredients wherever possible. But literally, Eric, like, we had suppliers who wouldn't work with us because we're in cannabis, for instance. And then we had suppliers who, it took them a lot to get to a place where, because they're so focused on pharma, and pharma's okay with, non-natural colors, and those are the things that work really well. It took lots and lots of R&D to make sure that everything we're doing from natural excipients and natural colors was going to perform just as well. So, but we've done it, and we're moving to clean label in a couple of months.
Nice. One more question here, and then we'll wrap up with a final question. Again, I think this is a conversation that's going on in the industry with the rescheduling. All of a sudden, there's a line of sight, knock on wood, to a significantly reduced tax burden in your regulated business. How are you planning for that right now? Are you already kind of setting aside tax, dollars to see, well, I might have to pay this, and if I don't, I'll just move it over into my bank account and invest in growth or what have you. But how are you thinking about practically how rescheduling impact? I mean, we know what it looks like on the P&L, but what are you doing in light of that now? Is it just still planning until there's a passage, or how do you think about that?
Yeah. So technically, we're not a plant touching entity, because we don't own the licenses and everything goes through our partner and we license it. So for us, the 280E impact is really going to be more beneficial to our retail dispensary partners and others in the value chain who, will be stronger and more profitable. And then that will have secondary effects on us. But we're in a, since the beginning, we've structured our company in a very tax efficient, smart way.
Yeah. Okay. Well, that's awesome. All right. Final question, just open-ended here. If you come on the show again in 12 months, June 2025, what are your hopes for what the industry experiences in the next 12 months, and what are your plans to participate in the industry over the next year forward?
Yeah, well, big news. We're very excited. We're launching our, so first we're launching a pain product, one for AM and one for PM in a gummy format in a couple of weeks. Pain is one of the top two reasons. Pain and sleep are the two biggest reasons why people walk into a dispensary. And up until now, there have been very few products that have been specifically formulated for pain outside of topicals. So pain is ubiquitous. It affects, millions of Americans. Most people will say that they're not satisfied with the pain solutions or the pain remedies that they have available to us. And we know that cannabis works. The issue has been that most people have been relying just purely on THC for pain relief or CBD, and sometimes a combination of both. And while those are great, there are many other cannabinoids that are critical to pain management and a well-functioning endocannabinoid system. So we've spent, a long time working on a pain formulation that combines other plant medicines, as well as a mixture of other cannabinoids that heretofore weren't available to people. So we're bringing the whole plant plus other plant, the whole cannabis plant plus other plants in a format, in a gummy format that I think is going to revolutionize the way in which we deal with pain. And having one for AM and one for PM is going to be great for people who are looking for solutions, that meet their needs. So this is, the biggest product launch that we've had in years, and we're really, really excited about addressing one of the biggest reasons why people are looking to use cannabis. So hopefully we can talk a lot more about the progress toward getting people off of opioids and getting people relief from pain.
Hear, hear. That's great stuff, Peter. We're out of time. We could keep talking for hours, but thank you so much for coming on. Really fascinating discussion. Kudos to all you've achieved. So we'll definitely look forward to keeping tabs on, no pun intended, 1906, and I wish you well on your new product launches. Peter, thank you for coming on. Folks, I'll remind you, we do have a month we're going to skip. There's a little vacation planned, but other than that, we'll see you in August with the next event, which I believe will be Jetty, Ron Gershoni from Jetty coming on. So anyway, thanks everyone for joining. Peter, appreciate you so much, and continued success. All the best. All right, folks, take care. Have a great rest of your day.